Let's review the categories for burn depth. The older terminology referred to these as first-degree burn, second-degree burn, and so on. The first-degree burn is also known as superficial burn. The superficial layers involve the epidermal layers of the skin. So this burn depth is sometimes referred to as epidermal burn. Superficial burns present with skin redness and the healing time is from say 3 to 7 days. Pain is often minimal. Second-degree burns are called partial thickness burns, and partial thickness burns are further divided into two categories, superficial and deep. So you have superficial partial thickness and deep partial thickness for second-degree burns. With superficial partial thickness, the epidermis and upper dermis layers, I'd say upper but more like outer, are involved. You get blistering and erythema, which is a superficial reddening of the skin. Pain is a little bit more significant and healing time is from 1 to 3 weeks. With deep partial thickness burns of the second-degree burn, the epidermis as well as the deep dermis layers are involved. It often involves blisters and there is a higher chance of infection compared to before. It varies in color from white to red. Pain is often quite severe, and due to this depth of the burn, patients may experience some loss or impaired sensation. Also, the chances of scarring, such as hypertrophic scarring, is high, and the healing times can vary from 3 to even 9 weeks. Next, we have the third-degree burn, which is known as a full-thickness burn, which extends through to all the layers of the dermis, as well as hair follicles, sweat glands, and nerve endings. It presents as like a leathery white to gray and even charred black appearance. The skin is dry, pale, and does not blanch. Due to this depth of burn, it is actually pain-free and there is no sensation to light touch. Last, we have the fourth-degree burn known as subdermal or deep burn, which extends into the underlying tissues, including the fascia, muscle, even bone. This makes it potentially life-threatening as there can be charring of underlying layers. There is significant peripheral nerve damage quite often with this. This usually requires surgical intervention for wound management, and the potential for scarring is very high.